Following the presentation of my lecture to the Society for Psychical Research on the 7th, and the presentation of 3 case studies using telepathic hypnosis, I'd like to finish this series with a discussion based on some of the issues that were raised at the end of the lecture. Now, let me first of all reiterate the reason for presenting these case studies. It's to raise awareness of the scientific validity of the method being used, that is telepathic hypnosis, and to invite the testing of the method by experienced research analysts in the healthcare sector to test its efficacy in comparison with other treatment methods. Now, it's my belief that the use of this method could ease the suffering of a great many people who are currently being treated in psychiatric hospitals with medication. And this will also reduce the costs of treating such cases. It could also ease the pressure on mental health services by freeing up beds for those who do need specialist inpatient care. So one very important question could be addressed with an investigation into the efficacy of this method, as well as addressing patients' health and well-being. And that is, how much money could be saved for the NHS in the long term with the application of this method. Now, the following items for discussion are of a purely pragmatic nature and do not include the discussion of any issues of a theological or philosophical nature. So let's first of all look at the advantages of the method. The first advantage, from my point of view, is that conscious awareness is bypassed, and therefore any conscious resistance or objection from a patient in their conscious awareness is bypassed. And we can access the mind of the patient through the subconscious by telepathic means. And by doing that, begin to build trust via the dissociated consciousness of the patient. I find this a tremendous advantage. Also, time and distance are irrelevant. So there's no need to allocate a specific time or place for the therapy to take place, because it's done beyond time and space. That means administration and logistics costs are reduced. There are no travel costs for therapists. So I see these as the principal advantages of the method, and it allows myself and my colleague to work from our own premises without travelling to. In fact, a lot of our cases are in other countries. We work from UK and we treat people in North America, Northern Europe, Australia, New Zealand, all over the place. Now, the disadvantages of the method, it takes 2 practitioners. It takes a therapist and a medium. That's not a big disadvantage, but it means that we have to coordinate our timings between us. But it can be seen as a disadvantage. A big disadvantage needs to be discussed is the practicality of using the method within an institutional treatment environment. That takes a bit of thought, perhaps. And of course, it requires a completely open mind with the suspension of biased beliefs. But moving on, for me, what is the most important issues for discussion is, how is the efficacy of this method to be measured? Psychiatry and psychology have the tools to measure the quality of life. Psychology has the tools at its disposal to measure health outcomes, and these tools can be applied to any treatment method you care to name. They just need to be applied to this method. And broadly speaking, there are three methods that can be used for testing the efficacy of this. We can look at single case studies that are presented according to an established critical format. The second one is if you've got a case, a quantity of cases. Now at the moment my filing cabinet holds 150 cases using this method. So descriptive demographic statistics of the case file database can provide an awful lot of information on the demographic nature of the patients, diagnoses that they've been given by medicine, the methods used, how long it's taken to treat them, and so on. Very, very valuable method of analysis. A third method is qualitative discourse analysis. To take psychological qualitative methods and analyze the discourse between therapist, patient, and family members. And this, of course, takes skill and requires specialist training in these methods. So really I'm appealing through these presentations to scientists and healthcare professionals who have these skills, who know how to do this, to come along, look at our cases, see what we're doing, and analyse them. And without any further ado, I'm going to end it there and invite anyone who sees this recording to contact me, make a contribution to the debate. Thank you for listening.